In part 1 of this series entitled Sick and Tired, I listed 3 key points that I believe every person who is experiencing symptoms needs to know and understand before making any major treatment decisions. The first key point was understanding the main differences between conventional and alternative medicine. Now I will address the second key point, understanding the difference between an acute health condition and a chronic health condition. An acute health condition can be defined as any illness or set of symptoms that comes on suddenly and tends to be short-lived. Some examples include various injuries, such as broken bones, burns, and skin wounds, food poisoning, accidental overdoses, appendicitis, acute infections like colds and flu, and so forth. Most acute health conditions are generally well managed by conventional treatment options. In fact, every year people from all over the world come to the United States seeking effective and even life-saving treatments for what conventional medicine is best at solving, acute conditions like trauma and infectious disease. In contrast, a chronic health condition can be defined as any illness or set of symptoms that develops slowly over time, remains persistent, or tends to recur. Examples of some of today's most common chronic health conditions, many of which were unheard of just a century ago, include depression, anxiety disorders, insomnia, allergies, eczema, environmental sensitivities, asthma, migraine headaches, arthritis, adult acne, cancer, diabetes, obesity, chronic fatigue syndrome, hypertension, heart disease, cancer, gastrointestinal disturbances, and immune system disorders. And this is not an all-inclusive list. These days, it's hard to find anyone who isn't suffering from at least one variation of these types of conditions. Keep in mind that some acute conditions can also be considered chronic if an individual repeatedly suffers one acute episode after the other. Some examples of this include the common cold, strep throat, and ear infections. Chronic conditions continue to emerge in record numbers throughout the population, which is why I chose to get involved in co-authoring Dr. Stoll's latest book called Beyond Disease Care, set for publication in late 2010 or early 2011. With more than 133 million people suffering from chronic health conditions in the United States alone, this category accounts for a whopping 85% of the complaints seen in family practice clinics today. Unlike acute conditions, chronic conditions are neither cured nor well managed by conventional treatment options. Instead, this category is best approached by all the other globally practiced paradigms which have both prevention and health promotion as their mainstays. And this leads us to the third key point that is vital to your understanding when it comes to making informed decisions about your own personal health care. There is a big difference between a treatment and a cure. These two words are not synonymous.